Hello, my friends. We got a beautiful day on the lake here, and I thought today I would talk about something that is extremely overlooked when it comes to your health and your well-being, which is the art of standing, the simple art of standing. But I can tell you, as a physical therapist, I've treated lots of people in pain, neck pain, back pain, shoulder pain, all that, treating people with disabilities. The simple act of standing is the most overlooked, underappreciated thing that no one is talking about, and it impacts us on every single level, from our physical health to our emotional health. How we stand, how we carry ourselves, it affects how we see ourselves and how others see us. But there's even more science coming out that how we position our bodies impacts our endocrine system, our hormones, testosterone and cortisol all get impacted. The more we look into this, the more I think we'll discover it impacts every single system in our body, because we're, in a very real sense, claiming to our body what we're worth and what's happening and our perception. So I want to bring more awareness to this and teach you some of the basic principles that I've been teaching my patients for over 10 years now. And kind of giving them the best results possible. So I'm going to first talk about what we don't want to do, right? So habits, this is how most of us are standing. We're kind of standing one foot out and leaning to the side. This is more pressure on our hip. This is more pressure on this knee. Our back is shifted when we're doing this, This is kind of from the frontal view. We tend to toe out quite a bit, kind of collapse feet. Collapsed arches are problematic with this. From the side angle, many of us are shifted in our pelvis. We're overextending in that low back, kind of that lordosis, lower cross syndrome area, or we're kind of collapsed like this, right? So many of us are molded into that flexion position from sitting on the chair for so long, bent knees. So we'll see that as well. In the upper segment, a lot of us are kind of forward head, rounded shoulders, rounded spine. All of this causes lots of tension in the back, pain in the shoulders, pain in the neck, obviously. And then we also get these overcompensated kind of military type postures of I'm up, So a true posture, true standing posture is a nice balance and ease to it, right? There's no excess tension, right? So I'm going to walk you guys step by step how to do this. So you can stand up with me, bring in your friends, bring in your family, let's get everybody around, let's all start standing tall. Rule number one with standing is have your feet pointed forward, okay? Not one foot out to the side, not both pointed out. Feet forward, directly under the hips, okay? The next thing I want you to think about is imagining your feet are on plates that can kind of spin out. Right? So what I want you to do is think about screwing your feet in the ground. You're applying that external force, that rotation force going outwards as you keep your feet forward. So you're not actually spinning your feet, you're putting them forward and applying that pressure of rotation. And when you do that, I want you to feel how your glutes, your butt, just got activated. Right? This is critical because we have a cultural, worldwide problem called gluteal amnesia. Our butts are asleep because we've been sitting on them. So we're not activating them, and that's what's causing this big high arch or that sag. So we want to create stability in the pelvis by screwing our feet in the ground, okay? Have your legs straight, but do not think about locking them straight. Some of you do not need to straighten your legs any more than you already are because your legs are hyperextended. So just straighten your legs, stand tall, screw your feet in the ground, feel your glutes being activated. And the next step is the belly. So kind of imagine, you can hit yourself in the belly. Imagine someone who's punching there and you're just kind of bracing it, right? You're bringing the belly button towards the spine, and this whole area, this whole torso has a sense of contraction to it, right? You're not sucking it in like you're holding your breath. It's just a brace, a strong, stable brace. So we're moving our way up, screwing our feet in the ground, legs are straight, glutes are activated, bracing the midsection torso here. Next step is we want to get the upper segment aligned. So take your hands, bring them right here, and then hands to the side with the thumbs pointing forward, okay? So when we bring our hands right here and we're standing tall, this sets the scapula, the shoulder blades, on the rib cage where they're supposed to be as opposed to there, right? Once those are set, then you can bring the hands to the side with the thumbs pointing forward. I want to stress thumbs pointing forward because we do not want the palms pointing backwards, right? This is internal rotation and contributes to that. So get in the habit, setting your hands here, thumbs pointing forward, and then with your chin, keep your chin parallel to the ground and retract it just a little bit. So most of us, because we live in this world of computers and texting on the phone, we're a little bit more forward than we need to. The ears should be in line with the shoulder here, right? So let's go through that again. And now I want to focus on the level of tension you have in your body. So this time I really want to take it to the area of 100% tension, right? So feet are forward, screw your feet in the ground and squeeze your glutes as hard as you can. Squeeze your legs straight as hard as you can, 100%. Brace your stomach as hard as you can, 100%, right? Hands right here, thumbs forward, neck is in a good position, 100% contraction and tension, and now back off to about a 20% level of tension, right? So that 20% level of tension is kind of where you want to live. That's where you want to be when you're having a conversation with someone and meeting, when you're at the checkout corner, you know, talking to somebody, when you're on the street waiting for a bus, whatever. Find that level of 20% tension and live there, because that's what's going to help activate all your muscles and keep you stable so you don't collapse, right? This is not what we want to do, okay? So kind of bringing this all back again, right, of the importance, because again, it's so overlooked, but it's so important that you bring awareness to this in your everyday life. I encourage you to be at least as interested in your standing posture as you are in everything that's going on outside. The conversation you're having, what you're watching, be interested in this. Now I know for some of you, you're gonna say, well, it hurts for me to stand like that. And I totally get it. Many of you are restricted in your joints and you have negative adaptations in your muscles. My advice to you here is just do the best you can and find that point of where your body can agree with it. You know, if it hurts to stand tall, then just do the best you can and take it up to that certain point where you can live with it. And what you'll find is over time, the more you breathe into that, the better your body will be able to shift and adapt. But this has every bit of impact on who you are. What you're doing when you're standing like this is you're claiming your worth as a human being, what you are, who you are. Because I know who you are and I know what you are, but it's important that you get it on a real deep level and you start standing tall. And from that place, you can speak better. You can create your life. You can create whatever it is that you want, but the foundation is how you show up in the world. So let's be tall, my friends. Feet forward, screw your feet in the ground, activate those glutes, brace the belly, hands here, thumbs forward, chin in a good position, be tall, love yourself. I hope that helps. If you find this inspiring in any way, please share the video, spread the word. We need to get more people standing tall and being who they really are. Okay, my friends, I'm gonna go walk that dog. You guys have a great day.